I just dropped to the floor and then woke up to paramedics around me.
And you have no recollection of that?
No.
Yeah, you don't have cancer.
Oh, it's nice to know.
It's very nice to know.
Considering your history, it might be a case of actually getting reassessed back at the hospital today.
Yeah. Do you know what? I don't think I've ever had somebody blow that hard.
Well, I've always been told I'm full of hot air. So.
I'm a Brummie through and through. I went to school here, went to university here, and I trained as a doctor here, and now work in South Birmingham at Hall Green Health. I've been a GP at Hall Green for almost 10 years, and I had plenty of opportunities to work in other practices, but specifically chose Hall Green Health just because it felt like one big family, and I wanted to be part of that family.
How are you today, Ashley?
Yeah, not too bad. Yeah. Yourself?
Well, getting on with it like the rest of us.
Yeah.
That's all you can do, isn't it?
Yeah.
Yeah. Hi, Ashley. Come on in.
Thank you.
Bye, love. See you in a bit. Hi, come
Hi,
on.
how are you?
I'm
Oh,
Dr.
this is
Ramshaw.
fancy. Wow.
Isn't it?
Yeah. Where do I sit on this
There.
one?
Yeah.
All right.
Nice gold chair.
Very fancy. How are you?
I'm good, thank you.
Good, good.
Right, what can I do for you?
So, something that I've never really had before, never had food allergies, anything like that. I seem to get the sort of remnants of one there, in my eye, fat lip, and it sort of lasts a couple of hours and then it goes away. Probably the most extreme has been the breakout I had on my right-hand side of my stomach on Friday.
Right.
Quite large hives, very hot and red
Yeah.
and raised.
Yeah.
Itchy palms and
Right.
swelling and itchiness on the bottom of my feet as well. And it just
Okay.
seems to come and go randomly. And then I was finding I was having asthma attacks as well, which I've never had asthma before.
Right.
At the moment, my suspicion is milk. Probably the feet is the bit that's worrying me, and the asthma attacks get quite scary actually.
Yeah.
So
Okay, so a few things really then. So you haven't changed any products on your skin or anything like that?
no,
No,
so don't
but you
use
haven't
fabric
changed
softener.
it. No.
I mean,
okay. And you mentioned you thought it could be milk related.
the asthma attacks were coming quite early in the morning. I'd have my bowl of cereal.
Right.
I'd get to work, and then
Okay.
I was wheezy and just short of breath the whole time.
Okay.
And then I've stopped doing that now, and I haven't. It stopped.
Okay. What actually happens?
Just really, really struggling to breathe, and then I'd say 2 or 3 hours, I'm back to normal.
Okay. And you also mentioned the lip
The
swelling?
lip, it just.
So when did that happen?
2 weeks ago, I think, straight after a cup of tea. You know, I don't want to keep bringing milk into it, but just before I went to bed, and then that side of my lip swelled up. Quite fat, actually, kind of dropped into my mouth.
Okay.
Just a little.
And how long after the cup of tea?
It was almost instant.
Right.
Yeah, I've always had good health.
Yeah.
That's why this is quite strange. It's just come out of nowhere.
Okay. And have you tried taking anything for it?
And apart from antihistamine, I wouldn't even know what to
So have you tried some antihistamine?
No, we haven't actually, with that said.
What have you got now? Any rash or anything that I could see now?
I think probably just the last little bit there.
Yeah. What about your feet?
They're pretty gnarly. You sure you want to have a look?
Yeah, I do.
So
I'd rather see them than a picture.
Do you want to see them now?
Yeah.
Okay. Always seems to be the left foot and just in front of the heel, and it swells up quite severely.
Being a GP can be a bit like being a detective. You start with the history, and that's crucial. And then the examination can help a little bit as well, but generally it's more on the history and then experience with what you've met before. And then we can do some tests to help us work out what is going on.
Just looking if we've got a peak flow meter. Right. How tall are you, do you know?
6'1", I think.
Just to see how much puff you've
Oh,
got in your lungs.
I've done this before,
have
yeah.
you?
Yeah.
How come you've done it before?
We do it for work.
All right, okay. So if you stand up for me, get all the air into your lungs. I'm not going to put it in my mouth so I don't infect it.
Sure.
But you take a deep breath in
And then just keep...
and blow out as hard and fast as you can in 1 second. So like this.
Oh, okay.
Okay.
All right.
Good effort. 700, that's pretty good. Do you know what? I don't think I've ever had somebody blow that hard.
Well, I've always been told I'm full of hot air, so...
I like that.
So how can I help?
I have epilepsy and the seizures have been quite frequently.
Okay.
Within the past, I'd say, few months. They've been coming on a lot more, and it's been affecting me quite a lot. The hospitals, they haven't quite figured out what's actually triggering.
Okay.
So they don't understand at the moment what's triggering it.
Okay. And you mentioned you're having more of these seizures. Have you noticed any association with anything?
It's quite like it's stress related. So in myself, I've noticed it can be stress.
Okay.
So
what happens to you in a seizure then when you get stressed?
complete blackout. So I'll just literally like have the seizure and then just wake up on the floor and then just be out like dazed and not know what's going on, sort of thing.
Do you suffer from any allergies?
Just cats and dogs.
And do your eyes feel itchy?
They do, both of them, or is one worse?
Both of them.
Both of them, okay.
And he's got spray for that, and he's got allergy syrup as well.
I think this is more allergy rather than infection.
I had an allergic reaction to the hand gel and my skin was like really dry and it was like cracked and bleeding.
Right. Are you allergic to anything?
No.
That's great.
I think just my husband at the moment.
Yeah.
I'm allergic to you.
Something's happening, isn't it?
Yeah.
I don't know
Yeah,
what.
okay.
That's going to be the hard thing. It's not easy
Yeah,
to check
yeah.
for allergic problems,
Right.
but the fact that you've got some lip swelling as well and eye swelling, that's
Yeah.
more of a concern, really.
Okay.
I think it almost sounds like an angioedema sort of thing, but
God,
just swelling and
Oh, okay,
allergic
yeah, yeah,
reaction.
it was-
but
yeah.
what from? I think what I'll do is prescribe you an inhaler just in case it comes on suddenly again.
Okay, sure.
Okay, let's get some bloods done.
Yeah, okay,
Okay,
sure.
look at inflammatory levels. We'll check that vitamin D and then come back and see us.
Yeah, okay, sure.
We may need to refer you to an allergy specialist.
Yeah, that's fine.
But the wait for that will probably be significant.
Yeah, no, understandable.
If in the meantime at any point your lips are swelling and so take antihistamine straight away. If that doesn't respond, obviously, you know, depending on how severe it is, obviously 111 999.
Yeah, of course, yeah, for sure, yeah.
So I think it's going to be an evolving picture.
All right, thank you
Does
so
that sound
much.
all right?
Yeah, I'll go
An
on.
interesting
Go
one.
on,
I
yeah.
don't know the answer.
Yeah, I
we'll
wish I
have
did
to
as
try
well,
and work
so,
it out.
yeah.
Yeah.
Thank you so
Okay,
much
lovely
for your
to
time,
meet
appreciate
you.
it. Cheers,
Yeah.
thank you.
You've made my brain think.
Thanks.
All the best. Bye-bye.
See you later, bye-bye.
Ashley, can I ask you a question?
Yes, of course.
Where are you from?
From Australia.
From
Brisbane,
Australia?
yeah, originally, yeah. I've been on the road for a long time, but I grew up in Brisbane, yeah.
So what are you doing over here?
My wife's English, so I met her, she's going to kill me, 10, 12 years ago. So I was backpacking here and I met her over here and then we've done some travelling. Hello.
Same here, mate. I'm Australian.
Hey, how you
And
going?
my wife's English, that's why I'm over here.
Yeah. See,
24 years now, so it's a long time.
2 at the moment, but we've just bought a house, so it might be 20. So
it could be.
The glorious weather.
Yeah, it is.
It is, yeah.
Stop all the skin cancers. That's it.
Bring on the ashes, eh? That's all I'm waiting for. Good on you guys. Thank you so much.
Bye bye, love. Lovely to meet you.
See you.
Bye.
When was the last time this happened?
It was December time.
Talk to me about what happened in December then.
So I'd gone to a panto rehearsal. We was doing a routine, and I could feel my body like shutting down, and as it was shutting down, I just dropped to the floor, and then I just had the seizure itself, and then just woke up to paramedics around me.
And you have no recollection of that at all? No.
So when the seizures happen, it's just a case of not knowing what's happened and stressing me out.
How do you feel afterwards then?
It makes me feel tired and just drained. It just drains me.
Yeah, okay. I can see that you're on a medication called Epilim.
Yeah.
Is that right?
Yeah. I feel like it is helping, but at the same time, whether it's too strong or...
Okay. As part of your epilepsy, have you had a care plan at all? Has somebody given you a...
I haven't been given one.
Okay. So what I think probably it's useful to do is if I could complete that for you and send it out to you in the post, yeah? There's just a couple of questions really around, you know, what your goals are with regards to your condition. Do you want to just tell me a bit more about that?
Just basically be to manage it better and be able to not have that constant worry of when the next seizure is going to happen, sort of thing, and just get on with life and live it.
Is there anything that you can do to help you to achieve those goals?
Just keep on taking the medication I'm on at the moment and just keep on going about things.
Okay, good. That makes sense. Tomorrow, I'll write to the hospital to say patient's happy to be contacted to discuss epilepsy, and he's actually keen to get things under better control because at the moment the Epilim that you're taking doesn't seem to be fully controlling your seizures from what I can gather. Yeah?
That's correct.
Okay, fantastic. Anything else I can help you with today?
That's it.
Okay, well,
Thank
good
you
luck.
Thank you.
And all the best, Thomas,
Thank
okay?
you.
Take care, bye-bye.
Bye.
Hello. Hiya. Hi, welcome to the mobile surgery. Is it an appointment for Emily?
Yes.
Excellent. So you're going to see Dr. Ward today. He won't be a moment if you'd like to just take a seat.
Perfect. Thank you.
Have you got much planned for the rest of the day?
No.
I got today off.
Nice.
I've been waiting for this appointment for ages. These guys have been amazing to me.
That's really good.
NHS saved my life. I had chickenpox in June.
Okay.
And it attacked my lungs.
Oh my goodness, I've never heard of that.
Yeah, it was super rare. It was horrible. Spent my 22nd birthday in critical care.
Oh, bless you. Well, you're going to have to make up for it on your 23rd.
Yeah, absolutely.
Hi, Emily.
Hello.
Come in. Come in, take a seat. I'm Dr. Ward. Hello.
Hi.
Now, did I catch the end of something that you were in intensive care, is that right? Or
Yeah. I just caught chickenpox and it attacked my lungs.
Yep. So you had a pneumonitis, is that what they called it? Yeah.
Yeah, varicella pneumonitis. I was on a high flow nasal oxygen.
Yeah.
And weaned off oxygen and all that stuff, and I'm fine now.
Good.
But that's what all these little spots are on my face.
Yeah, you end up getting the little craters, don't you, unfortunately?
But they had to like peel them out. So, like, to test them, because this was, obviously, monkeypox was quite a thing then.
Oh, of course, and
So
they
they
were worried
tested
about
for
all
monkeypox,
the really strange, weird and wonderful things, didn't they? Yeah. So you're very lucky. Thank you. Well, you're unlucky to get it, but lucky to come through so well. Yeah.
Yes.
So what can I do for you today?
I have a lump behind my ear.
Yep.
Given what happened 6 months ago, I'm quite paranoid about my health.
Fair enough.
But it's been there for, I think, like 3, maybe 4, coming on to 4 weeks now. It's relatively painless, like it's not comfortable, and if you touch it, you can feel it. But I don't know what it is, and nothing's changed in 4 weeks, so almost 4 weeks.
Shall we have a look? Yeah. Do you feel unwell in any other way?
The last couple of days I've started to feel unwell, but I have been incredibly sleepy.
Yeah.
But I have just started a new job.
Okay.
So I've gone from office job to like very labour job.
Okay. Yeah.
So I don't know if that's causing the sleepiness more than, but again, because it all happened at the same time.
Possible.
Yes.
Can you ever stand up for a second? We'll have a quick look at that little lump. So, if you just keep your head nice and in a normal position. Oh, just here.
There you
are. Okay. But it's not particularly tender when I'm pressing on it, but you just feel it there.
You can feel it, and it's sensitive, but it's not like excruciating pain.
Okay. Okay, take a seat. So the good news is it's nothing terrible. Okay. It's actually a tiny little cyst that's sitting in the skin behind the ear. You can get lots of glands that can go up, okay, which is, I think, where you probably get worried about things and you think, oh my goodness, my glands are going up. But this one feels more like a little cyst, very superficial, just sort of sitting under the skin as it is, okay. I think it will probably go away by itself, okay. It's not infected, okay, so there's no sign of inflammation or infection, so you don't really need any antibiotics at the moment. But I think waiting for a few weeks, maybe another 3 or 4 weeks to see how that goes is reasonable at the moment, yeah?
Thank you.
Is that okay?
Yeah, that's fine, that's perfect. Thank you so much.
You're welcome.
Cheers. Have a lovely day.
Yeah, same to you.
Thank you.
You take care. Bye-bye.
What brings you here today? What would you like me to do for Robert?
It's his left ear.
Mm-hmm.
In about October, one of the doctors here noticed a lesion on his ear.
Mm-hmm.
She referred him to the dermatology department, and it was all fast-tracked and photographed and biopsied, and then we just got a letter in February to say, use this cream for 3 weeks, and it's left it raw.
Mm-hmm.
You know, it's sore, it's bleeding.
Okay.
Just wanted it looked at, and
Sure.
and some advice about how to...
No problem. So, just to clarify, you were prescribed this medication, and did you put the cream on as you were meant to? You persevered despite all the inflammation and all that?
Absolutely on the spot, you know.
Yeah.
Brilliant.
Every
Okay.
day.
Good. I'm actually really glad you did that. I've had a little look through the letters. They've done, the biopsy results are back. We know exactly what this is. It's not a type of cancer.
Yeah.
Which is the main
It's
thing.
not?
No. That's why they sent you off to the clinic, was to make sure that it isn't cancer.
Yeah. Oh, it's nice to know.
It's very nice to know. I'm pleased. I'm sure you are pleased about that as well. So yeah, you don't have cancer of the skin of any type. So what you have is a thing called actinic keratosis, which basically just means the skin there has been very damaged by the sun. And a very, very small, very, very low risk, but a small number of those things, people with actinic keratosis could go on to develop a cancer.
Yeah.
So the thought process behind this cream is to destroy the sun-damaged cells. It is an aggressive treatment, okay? So you're putting that cream on there, and you do have to, unfortunately, to some extent, tolerate, if you can, all that inflammation and horrible irritation. It's not a nice thing to experience, and you're lucky in some respects in that it's only a small area, because some chaps, they've got a very bald head, their entire scalp is actinic keratosis, and you put this stuff on them and it's like torture. The whole scalp is like that. So
Horrible.
I mean, it's not a pleasant treatment, but it's actually quite effective, and you've gone through it, okay? So you've kind of got through the worst of it. Yeah.
I thought a couple of days and it'll be clear.
I think you're going to be going through this irritation and discomfort for 2 weeks minimum, and then routinely we'll have another look at it. All right, the pressure's off because we know it's not sinister.
Yes.
I'll just have a quick look at your ear.
Hang on.
The other awkward thing is...
The
of course,
hearing aid,
it's-
it isn't going to be helping things. That's lovely. It may not feel lovely, but that's perfect. Can you hear me?
Really?
Yeah, it looks fine. It doesn't. There's no. The most important thing is you've got to think about infection
Well,
as well.
what about when it bleeds?
That's just all part of the healing process.
No,
It will.
how do I treat it?
I'm going to give you just a simple cream that's going to be moisturising, soothing, put a bit of layer over that, dampen down the irritation. But this is all part of the process.
That's fine. It's the unknown.
Yeah. Yeah, I mean, obviously, if you get profuse bleeding and it's not stopping, that's a different story. But for now, everything looks like exactly as I'd expect it to be going.
Oh, good.
Any other questions for me today?
No, that's fine.
All right. Lovely to meet you. Take care.
Thank you very much.
Good.
No problem.
All that worry.
Sorry, cheerio. You've done very well to get, to stick to the plan despite your concerns.
Okay, thank you very much.
Bye.
Bye.
Jane King, please.
Hello. Shall I leave my coat there?
You can do, yes. I'll look after it for you.
We trust Bernie. It's very warm, no. I'm Dr. Arif.
Arif, yes.
Yeah, how can I help?
I don't know if you've read my notes, but I came in a couple of weeks ago. I had a bad cough.
Yes.
And I've had antibiotics and steroids.
Right.
But I've still got this ongoing cough. And I've got this terrible tiredness. And if I go up the stairs, I'm breathless. But you can see from the treatment I've had anyway,
Yeah.
the embolism on my lung,
Yeah.
and I had the tumour.
Yeah.
So that scares me because a cough clearly on my lungs.
Yeah.
You always think about that time.
Of course, of course. So the main thing you're saying that you've got is a cough. And what about temperature? Is that still something that's bothering you?
I think I've had a temperature over the couple of days. And when I go into environments, I get very anxious, you see, because I do suffer with anxiety. So.
Yeah. Okay.
So it starts to kind of rise anyway, and I have to try and...
Okay. So your main concern is the fact that the symptoms haven't quite disappeared, and whether it's the infection hasn't quite gone away, or whether it's something else that we need to be worried about.
Yes.
Sorry. Okay. Brilliant. Okay. Should we have a look at you?
Yeah.
Yep. Don't be worried. You've been through this before.
I have.
It's just a bit of an examination. Temperature first. I'm going to choose the right age because you're above 36 months old, aren't you?
Just about.
Just about. So your temperature is all right, but just about all right.
Okay.
Which I wasn't expecting, to be honest with you.
Okay.
Pop your finger on there. There we go. And while we're doing that, do you mind if I just lean you forward to have a listen to your chest? Okay. Deep breath in and out, please. And out. Very good. Just relax your hand down. Just the fact that
What's happening with this thing?
I'm not sure whether it's this monitor. It was bleeping because your oxygen levels weren't going above 92.
They don't feel brilliant to me.
Yeah. Yeah, it's just a bit of a surprise, really. Why is your oxygen level only 90%?
What can I do for you today?
So like last night, you just couldn't breathe properly.
I had really, really bad breathing. I'm still out of breath.
I can feel every breath.
Okay.
If you listen, it's still not cleared up.
Okay, so I'm just going to check his oxygen levels.
You've probably had this before, haven't you?
Can't get through your... What's that?
It's gel.
That's not bad, actually.
Oh my God.
99%. That's fantastic.
Wow, 100%.
100%.
I don't think I've ever seen that.
Just while we talked very briefly about the treatment that you had for your breast cancer, is that all finished now, or are you still in follow-up, or?
No, I finished that, and I didn't have reconstruction because I had an embolism while I was having the operation.
A pulmonary embolism means that there's a clot in the blood vessels inside the lungs. It can be a serious medical condition because people unfortunately have died from pulmonary embolisms. Yeah.
Because I think it was the embolism they were more worried about than the actual breast cancer.
Yeah.
Do you know what I mean?
Yeah.
Because I was shuffling and they couldn't find it.
But did they find out why you had an embolism, where it came from? Did they?
From this, no, it was just they just said that they felt that it was because I was under the surgery, having the surgery, the embolism developed.
Developed from that.
And then when I came out of the surgery and tried to walk around, it took them a long time to find the shadow though. Came home first and they found it eventually, but I shuffled around. I couldn't have even gone upstairs. So I'm nowhere near as bad as I was then, but I'm always worried.
Do you find you get really anxious and
Very
pet
much
up with any symptoms? You get really heightened to symptoms. Examination-wise, apart from this, which I want to check a couple more times, you're examining actually okay. Your chest isn't too bad at all.
That's good.
There's a couple of sounds in there which I think maybe it's leftover infection that still needs a further course of antibiotics and steroids. But the only thing is your oxygen. Why is your oxygen level only 92%? Considering your history of clots, although you've got no symptoms of a clot, I can't get an oxygen that I'm happy with. It might be a case of actually getting reassessed back at the hospital today
Okay.
to make sure we're not dealing with anything else that's come back again, like another clot, for
Yeah.
example.
Yeah.
Which I think is very unlikely, but
Yeah.
probably better to err on the side of caution.
Okay.
Should we measure it again?
Yes, please. I just feel.
No.
I just feel.
And your pulse rate is racing as well.
Is there something going on?
Yeah, your oxygen level's not where I want it to be. I'm a bit worried.
It's not where I want it to be, to be honest.
And your pulse rate is a little bit high.
There's no way I could go out walking my dogs.
Yeah, and I think the fact that you've got this history of a clot and things just makes me a little bit worried, to be fair. So I think what we need to do is, I'll do the prescription for antibiotic steroids for you now, so you've got that to the chemist, that's done. But I'm also going to give you a letter to take to what we call SDEC. Rather than waiting hours in A&E, you just go straight through to SDEC and you just get sorted.
Thank you very much, that's
so I think it's probably the best thing to do. Is anybody able to come and collect you and take you up
my
there?
daughter will be able to.
Okay, so let me do the dutiful, get your letter sorted.
And it's got to be done today.
It has to be done today because we're saying that we need to rule out a clot. That's something that needs to be ruled out today.
Okay.
That's all done. Is that okay?
That's
So you just pop outside, take a
Thank
seat, and I'll be
you.
with you in a second. There you
Thank
go.
you.
Thank you.
Come and have a seat. And how can I help you today?
Right. I found a change in this boob.
Okay.
The nipple area. It seems to be a bit flatter than the other one.
Right.
So my future past with cancer, I thought, gotta come.
Yeah. When did
just
you
to make
notice
sure.
it?
A couple of weeks ago. I'd actually scratched the top, and in the shower I thought, oh, I'll scratch it and
Yeah.
come on me.
Is it itchy?
It's actually itchy all round, actually. And I've got a couple of dots where I have been scratching there.
Okay. And the nipple looks different to the other side to you?
Just slightly.
It's just slightly indented, isn't
Just
it?
slightly indented a little bit.
Okay, all right. And you said it's been itchy. Has it been red or swollen at all?
Not swollen. I don't think it's been red, but it has been itchy.
And any discharge coming from the nipple at all?
No.
No, okay. And have you felt any lumps? Have you examined the breast yourself?
I can't feel anything, but I'm not sure whether I know what I'm looking for. I do get a lot of aches and pains in general, so if I do press something and there's a pain there, I'm thinking, is that something there, or is it something to do with just my general aches and pains all over? So.
Okay. Would it be all right to do a breast examination today? Yeah, so I can pop you behind the curtain, and then if you can take off your top layers for me.
How's your day going so far?
All right, I've had 3 lots of good news today. My granddaughter's passed her driving test.
Oh, that's exciting.
My grandson has got into the uni, and I've become a great-grandmother again.
Wow.
Last night. So
Congratulations.
it's been a really good day.
Pamela, hello.
Yes.
I'm going to have to stop you there. Come in, I'm Dr. Ward. Hello there.
Hello there, Dr. Ward.
Come and take a seat.
Thank you.
That sounds very exciting, getting all those new...
Yeah, good. Been a really good day so
That's
far.
fantastic. Well, let's hope I can continue to make your day good as well.
You see, like that.
Yep.
And that one.
Yes.
And that one. I was treated with a fungal infection for over a year.
Yep.
Well, before that,
Yep.
and then it just doesn't make the slightest bit of difference.
Wow, and they were tablets that you were taking for over a year. It was just it doesn't
And
get
it's
credit.
is that what it is though?
The answer is probably. Okay. The only way to tell for sure. Did you ever have any nail clippings sent off at any stage?
No.
No. I think because you've tried the treatment and that particular treatment and it hasn't worked, then it's probably worth us organising some nail clippings to be sent off, and the laboratory then looks at them and they say whether there's a fungal infection to it.
Oh, right.
Okay.
It's funny. It's not all my nails.
Yeah.
It's just seems to be that one a bit.
And those
But
two
it
there.
just-
Yeah.
Been putting this stuff on. He said, the doctor that I saw before, he said you've got to do it for a year. So I did it for a year.
Yeah. The problem with it is that the infection sits under the nail, and most topical treatments don't get under there very easily.
Yeah.
And I think that's where that difficulty lies with that particular type of treatment.
Yeah.
I think that if we get the clipping sent off and it comes back and it proves the infection, then the second form of treatment is to take an oral antifungal treatment.
Yeah.
Okay. But that may take a long time as well.
Oh, right.
It just doesn't go away overnight.
Because I've heard there's side effects.
It can be as well. Yeah.
What sort of side effects?
Okay,
are
so
there?
we worry sometimes about liver function when you're taking it. So we would often start the medication, but we will do some bloods after a couple of months to see how that goes.
Yeah.
And you would need to review it every couple of months to see if it's making any difference. Because if you've done it for 4 months and it's made absolutely no difference, then it's probably no use doing that either.
Yeah.
So, but that would be the next step.
Yeah. But it's funny, it seems to be the same nails.
On either
I
side.
don't have it on those. It's really strange.
Maybe do the washing up and leave those in or something like that. But I think we can sort that out and just to check and see what's going on.
Yeah,
Okay.
yeah.
So what I'm going to do then is what I need to do is we'll send you back over there. I need to do a form that asks for the clippings to be looked at.
Yeah.
If you go over there, they'll give you a little pot, okay?
Yeah.
For you to go away, and all you need to do is make some little clippings of the nails, pop it in the pot, and we'll see what that does.
Right. Okay, thank you very much.
You're welcome. So there's no bad news, at least from my side.
No, that's all right. My good news is continuing then. Okay, thank you very much.
Bye-bye.
Thank you.
Bye.
Bye. Thank you very much.
Thank you. See ya.
And how's the leukemia management at the moment? Is it under control, stable?
It is now, yeah, I'm in remission, so it's all good.
Okay. Okay, that's fine. So now this side. So I can see what you're talking about. In here in the centre, I can see the dry skin. And looking at both nipples, this one looks like it's a bit flatter, like you said, a bit indented. Is there anything else you've noticed about this side on the right? No. Okay. So I'm just going to feel gently for any lumps as well. The same as before, going in circles around. All right, that's fine. And when you're ready, come back out and have a seat. Okay, so from examining you, there's no lumps that I can feel in either breast, and feeling under the arms and the neck, it all feels fine. There's no lymph nodes that I can feel either. I can see what you're talking about the flattened nipple and the dry skin changes around there. Now, those are important and shouldn't be ignored because there are certain types of cancer that can affect the nipple, and for that reason we should refer you to see the specialist to make sure it isn't anything like that. What happens with the 2-week breast cancer referrals is that I do a referral for you.
Okay.
You should then get an appointment within that 2-week time frame. So they might do things like biopsies, blood tests, they might do some scans, ultrasounds, other investigations like that.
Are you concerned with it at the moment?
I think it looks like it could also be dry skin or eczema, doesn't it? So it isn't something that, you might, when it first comes up and it's been there for a couple of weeks, you might think that will get better with emollients, so I can prescribe you something to try for that. But the reason for the referral is to make sure it isn't something like a cancer, really, because you can get some cancers that can affect the nipple. So I think I'm glad you've come in and haven't ignored it. And I think the reassuring things are it's been there for a short time, a couple of weeks, so hopefully it isn't anything more sinister or worrying, but we can't leave it and just wait and see. I think we have to get it checked. Have I worried you?
Not really.
I think you've come in quickly after you found the symptoms, so that's really good, because it's been a couple of weeks.
I've been through a lot of cancerous stuff, so I'm not shocked as such.
Yeah. And this may be dry skin or eczema, it may well be that, but we can't risk leaving it.
That's it, I'm thinking, am I being a bit paranoid?
No, you've done the right
I'll go
thing.
and do it just in case.
Yeah, you've done the right thing to come in. Yeah.
Excellent. Okay. Right, we're done then.
Yep.
Lovely.
All
Thanks
right.
very much.
Take care.
Thank you very much.
Bye-bye.
Thank you.
Hello.
Hello there.
Is
hello.
it Paul?
It certainly is, yes.
Thank you. If you just take a seat for me, Paul.
No problem.
Thank you.
Mr. Harborne. Yeah, hello there.
Hello, sir.
Hello there, how are you?
Very well, thank you. Come and grab a seat.
Thank you very much.
Right, I'm Dr. Arif.
Hello there, Doctor.
Hiya.
How are you?
I'm very well. How can I help you today?
12 months ago, just over, I lost my wife to COVID, turned to pneumonia. Initially, I struggled very, very, very badly. And like 12 months on, although I put on a brave face when I'm at work to people, because you have to, I do have days when I'm sort of really struggling and finding it difficult just to get through. Sometimes it can almost be like mental torture because you're thinking of things and you're thinking, oh God, I can try and distract myself, do something. And I mean, she did have an underlying health condition, but unfortunately getting COVID, it just went straight onto her chest, pneumonia. Because I work outdoors and work in the community.
You're mixing and everything.
I'm mixing, and every day it was just a huge risk. And as soon as we found out she'd got COVID, it was almost like, oh dear, this is not good.
Yeah. When your wife was poorly,
yes,
before COVID,
yes.
How were you in yourself?
18 months before I lost my wife, I lost my mother, who I was very, very close to. And that was a massive shock.
Everybody's different, isn't it, in terms of their internal capacity to cope with things. And when you lose a loved one, that's challenging, you know, and you've had two bereavements very close together. So it's not surprising that a year or so down the line that you're kind of still experiencing some symptoms of grief.
I sort of learned to deal with it. So like now, if I think I'm getting a bit sort of uptight, it sounds crazy, but I'll start talking out loud to her as a comfort.
You kind of feel her wearing that.
Yeah, and I've got a funny picture of her by the TV, so as I look up at the telly, it's almost like she's looking straight at me, so I feel that she's there, so I can look across and know that
that's there.
It's there.
What about things like harming, self-harm and...
No, I'll be honest with you, when I very first lost Dawn, I felt very... I thought, you know what have I got to live for here? I mean, I've got two sons, I've got a grandson.
But you're in a different place now.
I'm in a different place now. I'm in a much better place. Don't get me wrong.
And I guess, you said you've got children and you've also got grandchildren.
And I've got one on the way, another one a grandchild on the way.
There's all of that. You want to see granddad, don't you?
Yeah, of course.
What were your expectations from today, seeing a doctor today? What do you have in mind?
I was wondering if there's anything, as medication goes, if there was something that I didn't know what your feeling was, whether just to carry on as I am and nothing and just plod on, or is there anything that can... I don't know.
That's a really good sort of point to kind of pick up as to what we do in terms of an agreed plan moving forward. So bereavement is different for everybody. I guess it becomes a bit of an issue if it's affecting your ability to do other things or to cope
I suppose, I mean, it hasn't, if I'm being honest. Maybe I've definitely gone better. I'm not lying awake at night, can't go to work.
It is really up to you. There are lots of types of medications that are out there that might be able to help. They come with caveats though, because the caveats are they may make you feel worse in the first, especially the first 2 weeks of taking them. So you just got to be wary of that time frame. Look, there's no rush. That's the first thing to say. There's no rush. So if you think, actually, you know what, I just need a while to think about it, that's so fine, and I'm happy to rebook you back in. Entirely up to you whether you want a bit more time or whether you want to try something.
Yeah, I'll give it a bit more time, because as I say, I've certainly got better than I was. I mean, the pain's never going to go away, because obviously I've lost my soulmate, and it's like, if you want to, like, holidays, and to be fair, like with my brothers, I've got brothers, and they'll say, come away for a weekend, let's do this.
From their perspective, they want to spend time with you, and I think you're very, of all people, know that time is precious, and and if you have the opportunity, take it.
You're right.
So I think what we'll do is I'll book you back in to see me.
Yes.
Now before then, if you think, you know what, actually I changed my mind, I do want to try something. You can leave a message with the reception staff, and they will just leave a message with me, and I can get something sent to the pharmacy for you, or we'll just speak on the 7th of March.
Yeah, thank you, Doctor.
Thank you so much for your time.
Thank you very much. Yeah, that's all for you. Thank you very much.
Right,
thank you.
Bye-bye. Thank you.
What's it, lady got? This is a thermometer, ain't it? You've had this before.
Can you do a big ah like you did earlier? You were showing me. Say ah.
I'm not going to tickle you, don't worry. It ticklish. Oh, what a good boy. I think I'll be giving you a stick of water.
Oh, wow.
Do you like stickers? A crocodile. A crocodile, can you get him off?
Should we go now?
Sure. Can I get a high five?
Thank you so much.
Hello, hi. Hello, little Lewin. Do you want to come in?
Go and see the doctor.
Fantastic. In we come, everybody. Come and take a seat.
Come on, then. You're sitting there, are you?
Right. So what's happening?
Well, we've got a feeling he's got a chest infection.
Okay.
That's the main thing.
Yep.
When he's coughing,
Yep.
he's quite chesty, quite
Okay.
phlegmy.
Yep. Temperatures, fevers?
He had a temperature yesterday and he had a temperature the day before.
Okay.
But it was only slight.
And he's on an inhaler as well?
Yeah, he's using that both at home and at school.
Okay, good.
Okay, we'll get something in a minute.
Lewin, how about if I take your temperature and have a listen to your chest? Is that okay?
Yeah.
Yeah? Well, we'll do that quickly. And as soon as we get finished, then you can go and have something to eat. Is that okay?
Yeah.
Good. Okay, let's have a quick listen to your chest. Can we lift that up?
Lift his top up.
I'll try and warm it up. There we
You
go.
find this all funny, you laugh at this.
Can you breathe deeply for me? Let's have a listen at the back as
On the
well.
back. Every time he does it, he says it tickles.
And again, deep one. Well, he's not lost his sense of humour, is he? Okay, good. Yeah. So he's a little bit rattly. Okay, you can hear stuff rattling as he breathes in and out. He's not too bad. But the good news is that
He's
that's not
bringing up
happening.
rubbish when he's coughing as well.
I'm sure he is. Let's have a. Can I pop this in your ear? Let's see whether we can do that. See if we can take your temperature. Good. So 36.9. So not quite a temperature, but not perfect either. So his temperature isn't bad. He is, as you say, chesty, and there is stuff rattling around. My suggestion is that I prescribe an antibiotic for him. I'd like you to hold off for 24 hours.
Or
Or a couple of days,
Yeah.
just to see how he goes. A lot of these things are viral, and his body sorts itself out without the need of going down the line of antibiotics. So I think he's improving already.
I told you, he's like...
So I think it's probably worth having it, at home just in case. And seeing how he goes. If he does hit some fevers, then just using Calpol, that's absolutely fine. I'm not so worried about his tummy at the moment. I think that's going to sort itself out. Okay, we'll sort that out. We'll send it to there and see how you do. And if you're worried, please get back to us, and we'll see him again.
Thank you very much.
Okay, bye, mate.
You're going to say thank you?
You're going to do thank you? Shake hands. Well
Good
done.
boy, well done. Thank you very much.
You're welcome. Bye bye.
Bye.
Boys.
Nice to see you.
Oh, cheers, Doctor.
Okay.
Okay, nice to meet you both.
What's that? Thank you.
Good girl, well done.
Bye, Dan. Take care.
There you go. Thank you. Bye-bye. Bye.
Take care, love.
Your relationship with the patient is a professional one, and it always will be a professional relationship. But often we get to know people really well, and often those relationships can help in terms of how we can support them, because we know them a little bit more deeper than, say, an average consultation that you have in a hospital setting.
The tonsils are massive.
Yes, yeah, massive.
They're kissing.
And yesterday was quite severe.
Yeah, let's have a look.
That was yesterday morning.
Yeah, looked like being a few rounds with Mike Tyson, don't you?
I would like to run around with my kids. I end up stopping halfway. Sometimes I can't do it.